Welcome to our presentation. We're going to talk about de-escalating a patient who is angry about an aspect of your intervention. We'll demonstrate two situations for you. First, the incorrect, and then the correct way to handle the situation. The situation portrayed in this presentation is a patient who is unhappy about their treatment and outcomes. The communication exchange takes place in an outpatient physical therapy clinic. The patient has been in physical therapy for 3 weeks and has not seen any progress, so she is angry with her physical therapist. It's important to address the patient's concerns and de-escalate any anger so her experience is positive and she can have better outcomes.
Hi Holly, how are you doing today? How's your hip feeling?
You know, it really hurts. It's been 3 weeks and I don't think therapy is helping.
I'm sorry, that kind of sucks. Have you been doing your exercises at home?
Yeah, I've been doing them twice a day, every single day.
Well, maybe you're doing them a little bit wrong.
I'm doing it exactly how you showed me how to do them.
Hey Shannon, can I borrow you for a couple seconds? I just need you to
yeah.
consult on this patient for me.
Yeah, I'll be right back.
I'm out of here.
In this video, Shannon was standing over Hallie rather than getting down on her level. She didn't express any empathy towards the patient and placed the blame on her. She didn't give the patient any say in her solution or provide any choices on how to address her pain. Short-term consequences are that the patient is unhappy and will have a negative outlook on therapy. The value of her care is significantly decreased and there's a possibility she won't come back. Long-term consequences are that you can lose the patient's trust in you and physical therapy treatment and the patient's goals are not met.
Hi Holly, how are you doing today? How's your hip feeling?
You know, my hip still really hurts. It's been 3 weeks and it hasn't gotten any better. I don't think physical therapy is working for me.
It's still hurting? I'm sorry about that. I know how frustrating your pain must be. Sometimes injuries like these can take a little longer for you to see progress. But we can take a look at your exercise plan and see if there's anything we can adjust to make it better for you.
But my race is coming up soon. I need to be better for my race and I only have a few weeks left. I can't waste my time on exercises.
You have a race coming up? Is there anything you'd like me to do differently to help you achieve your goal and get you ready for your race?
My doctor did mention that dry needling might be a good option for me.
Okay, that's a great idea. We can definitely explore dry needling for you. Let's take a look at your exercise plan first, and if there's anything we can adjust, we'll go from there.
Hey Shannon, can I borrow you for a minute? I have another patient over here. I got a question for you.
One moment, let me finish up with this patient, and then I'll get back to you.
Alright, thanks.
While talking to a patient who's upset or angry, use active listening and allow the patient to express their concerns. It can be a bit intimidating for the patient if you are towering over them, so get down on their level as best you can while you're talking to them. Remain calm and express empathy and understanding towards the patient's concerns. Make sure that you're not defensive and don't place the blame on the patient. Consider all possible options. Ask the patient for their feedback and give them choices. While it's important to be respectful toward the patient, there needs to be a boundary. If the patient is getting too aggressive, it may be necessary to remove yourself from the situation and find help. Forming a positive relationship with your patient will build trust and increase the value of their care. The patient will be much more likely to follow your recommendations, leading them to better outcomes and setting them up to meet their goals. If you'd like more information on patient de-escalation, go ahead and check out these links.